People keep asking us, what is PCOS? What is PCOD? PCOS is Polycystic Ovarian Syndrome and PCOD is Polycystic Ovarian Disease. In fact, there is not much of a difference between the two. It is just that initially when this condition was diagnosed some hundreds of years ago, a couple of hundreds of years ago, they found that there was a correlation between obesity, acne, unwanted hair and irregular periods. And they named this syndrome. So whenever there is a combination of various syndromes which can be consistently found in patients with similar symptoms, then it is called a syndrome. When there is a combination of syndromes associated with a particular disease, it is known as a syndrome. So initially, that is the reason it was called Polycystic Ovarian Syndrome. Now later on, we realized it is just not Polycystic Ovarian Syndrome, but it is a disease pattern as a result of an imbalance of the hormones. The imbalance starts in the hypothalamus, where the LH hormone is more than the FSH. Now why does that happen? It happens in the adolescent period when there is obesity and there is peripheral conversion of the androstenedions which is released from the ovaries into estrogens. Whenever there is excessive estrogens in the body, it is then gives a signal to the brain, to the hypothalamus, to release more of LH compared to FSH, and that again acts on the ovaries to release more and more androstenedione, and that is again converted into estrogen. So we ultimately land up in a scenario, in a milieu, in an environment that is having excess amount of androgens. So this is the main crux of the problem. There is excess androgens. Now this excess androgens is responsible for the type of obesity, for the acne, for the unwanted hair, for the irregular periods, for the anovulation. Now when you go one step ahead, in polycystic ovarian disease, what happens is we get to understand it is just not a condition which just comes and then you do the scans and then you treat it in a certain way and then it disappears. No, we found out that once it comes, it stays on. It is a condition of a hormonal imbalance which can go on for a long period of time into the reproductive age group and still further. So it makes the ESHRE criteria says that to diagnose polycystic ovaries, we need to have two of these three criteria. First criteria is to have irregular periods. The second one is to have polycystic ovaries on a scan finding, and the third one is to have the laboratory findings which show that the LH is more and the androstenedions or testosterone is more, and sometimes it may be associated with hyperprolactinemia, and also that is the prolactin level can be more, or that the thyroid problem, hypothyroidism, may be associated with this. Now once this is diagnosed, the counseling should be done to the patient that you need a lifetime modification of your lifestyle, because this just comes to stay. It may be associated with other problems and it may be associated due to the hyperestrogenic state, may lead on later on in life to endometrial hyperplasia and also to endometrial carcinoma, and if the obesity is not treated, to a condition of obesity and increased hypertension and diabetes. So we have to understand that this is a disease spectrum and which has to be treated with a good lifestyle modification and advice with your doctor.